So from the actions of really slowing that spread down, slowing the virus down, a 2-week lag, and now we're seeing the increase in cases. And I want you to see this so you can see that we can take some of the steps that we took to turn this in the other direction. And it really just re-amplifies the message that you are safer at home. This is our percentage of positive tests. The blue mountain represents the number of tests that we have and the increase in tests. The gold line shows the positivity of tests. Again, headed in the wrong direction. So we've got more tests. We have more positive cases. And an increase in positive cases demonstrates that we have more spreading of this virus. So we're going to test more so we can isolate who's necessary, slow things down, and reduce the cases and positivity. So what we'll want to see is the blue mountain grow in terms of tests that we conduct, and the gold line bend down to lower positivity. Hospitals. We want to make sure we can treat all patients without crisis care. These are our hospital beds in Arizona. Gray represents availability. Blue represents inpatient beds in use for something other than COVID-19, and gold represents COVID-19 patients. So you can see an increase in the use of hospital beds and an increase in the number of COVID hospital beds in Arizona. Now, this does not include the beds that we have prepared for surge availability if necessary. This is just our current hospital capacity without factoring in surge capacity. This is our intensive care unit, ICU. If you get extremely sick, we want to make sure we can care for you. You can see the availability in gray. You can see blue is other than COVID-like illness, and you can see the increase in COVID-19 cases inside our ICU facilities. This doesn't include surge capacity. If you remember, we went and did the press conference, much different than this press conference, on April 9th at St. Luke's. So we have been preparing since March, April, and through May for what is upon us in Arizona right now. And we are prepared for what is coming. This also is a graphic that will show you that we've pretty much been, in terms of ICU beds, flat in terms of non-COVID-19 patients and increasing in COVID-19 patients in Arizona. Ventilators, we've got a lot of availability on ventilators, although we do have an increase in terms of COVID-19 patients using them, but we have plenty in our stockpile if necessary. I want you to know we're working very closely with our hospitals and our hospital leaders. They've been responsive, and we've worked to ensure that we can build capacity within this hospital system. We've done that through communication, partnership, relationship, and executive order. I want to thank Peter Fine at Banner Health, Linda Hunt at Dignity Health, Robert Gray at the Mayo Clinic, Todd Laporte at Honor Health, Bob Trenchell at Yuma Regional, Steve Purvis at Valleywise, that was formerly MIHS, and Judy Rich at Tucson Medical. I was able to visit with each of them, hear their thoughts, talk about our situation in Arizona, and I also want to thank them for their very good recommendations on how to contain this spread going forward. I'm going to turn it over to Dr. Christ, and I want to thank Dr. Christ again. She's leading our healthcare public health effort for her hard work and her team's hard work in Arizona, and talk a little bit about our hospital relationship in Arizona.
Thank you, Governor. So we've been working very closely with our hospital partners, the chief medical officers, the chief clinical officers, as part of the Crisis Standards of Care Plan, which is a plan that was implemented in Arizona at the end of 2014, beginning of 2015. We have a state disaster medical advisory committee. So this consists of members of hospitals, of healthcare coalitions, the medical boards, the nursing boards, groups of experts that come together. That group on Friday recommended implementing the crisis standards of care, which is really the framework so that facilities can be prepared if they need to have if there's a reduction in the type of resources or their ability to be able to provide care at that specific facility. So these standards, it was recommended that we implement that. ADHS, as of this afternoon, will activate the crisis standards of care. This will encourage our hospitals. We are recommending that they activate tactics to address space, to get their surge beds up, to make sure that they've got staffing and resources as necessary for that hospital's current situation. This is being put proactively into place so that hospitals who are on their own individual trajectory can implement these standards if necessary. We're asking them to prepare for surge and to anticipate fully staffing their hospitals. For those that do determine that they are in a crisis level, that they cease all surgeries except non-emergent essential surgeries and procedures that do not impair the care of other patients. We've asked them to activate their hospital incident command and do that on an increasing frequent basis. And then to make sure that they're establishing regular communication with their local health jurisdiction or their local public health department. Thank you, Governor.
Thank you very much, Doctor. Let's talk about testing in Arizona and our focus on testing and the information that it shows us. In Arizona, we've done over 677,000 tests. On the diagnostic or PCR, over 500,000 have been done, and over 166,000 on serology or the antibody test. We'll continue to focus on testing and increased testing. It's important. It gives us the information that we need. We're building capacity around testing. If you do want to get tested, and we'd like you to get tested, go to azhealth.gov/testingblitz. So we simply cannot let up. This is a time for us to put on a full court press as a state. We can't be under any illusion that this virus is going to go away on its own. Our expectation is that next week our numbers will be worse. It will take several weeks for the mitigations that we have put in place and are putting in place to take effect, but they will take effect. So over time, we'll see reductions and not increases. That's the goal. It will not happen overnight, but it will happen. And if every Arizonan will join in this and follow these steps, we'll slow this spread, we'll save lives along the way, and we'll see it reflected in this data. Of course, our objective is to protect lives and to protect livelihoods. And when in doubt, we are going to err on the side of protecting lives. We are going to err on the side of caution to make sure that we can deal with this pandemic in the state of Arizona. The objective is to slow the virus. The virus is not going away at this point in time. There is no cure. There is no vaccine. We want to slow it down. We've done that before, and we can do that again at this time. We need to do that again in this time, and we want to protect the most vulnerable. And the better we communicate and people realize how contagious and dangerous this virus is, the better able we will be to protect lives and protect our most vulnerable. The best way you can do this is to wear a mask. Mask up. I want to remind Arizonans to please wear a mask. I want to thank our local leaders for their communication on this with mask wearing across our state. We're also going to make sure at the state level with state resources that everyone has access to masks in our state. By the end of this week, not only will we have that program in place, every one of our correctional facilities, from correctional officers to inmates, will have a mask, and our inmates, upon release, are given 2 masks so they can begin their time in public wearing a mask. And the increased masking is working. This is the IHME modeling. Sometimes it's been on target, sometimes it's been off target. It projected in Arizona with mask usage on June 28th, yesterday, we'd be at 3891 in terms of cases. We hit that. We were at 3858. And they project, if you look at that descending line, with the continual use of masks, the decline that it will have in cases in the state of Arizona. So this gives us hope. It gives us a target and a plan. I think we all know this and understand it. If we'll hold ourselves accountable to doing it, it will make the biggest possible difference in the spread of the virus in Arizona. And I'm asking every Arizonan to do their part. I mean, as we know more about this, it really makes sense that this idea of physical distancing, of washing your hands, of staying at home where you are safer can make the difference in terms of slowing this spread. It's common sense, it's personal responsibility, it's good habits, but we're not going back to normal anytime soon. This is the way to protect the most people in our state. Let's make sure it's part of our routine. I also want to talk about a number that I don't think has ever come up at this press conference. It's a number that's on discussion with the White House Coronavirus Task Force. It's one that's been topical also on the governor's conference calls. It's called the, if you look at that symbol of R, lowercase t, you pronounce that, epidemiologists call that R-naught. And that shows the average number of people who become infected by an infectious person. What you want that number to be is less than 1. If it's less than 1, you're slowing the spread of the virus. If it's more than 1, you're increasing the spread. And I've talked a lot about states that were hit first and hit hardest and hit before us. New York certainly received a lot of attention, and we learned a lot from what happened in New York. Massachusetts was in that same juggernaut of virus spread, and Charlie Baker helped me, the governor of Massachusetts, helped me understand some of the things that they did to get folks to understand how to get this below 1. And I want to show you where Arizona is today. We're at 1.18. Okay, so we're 18 basis points over 1. It wasn't that long ago that Arizona was under 1. And for those of you that want to check more into this stuff, that's the website at the bottom of the page, the //rt.live. You got to put both the slashes in or you'll go to the wrong website. And you can look interactively at where Arizona is, where every other state in the nation is, and you can see that it wasn't that long ago we were beneath 1. Okay, that's where we need to begin to trend again. That allows us to slow the spread and in time have other alternatives in terms of therapeutics, vaccine, cures, whatever our incredible medical professionals across the nation are going to bring to us. But until then, we have got to slow and contain this spread. So we brought this number down a bit in the last couple weeks. We've seen it flatten and lower. We need to bring it down further, and we need to bring it down faster. This gives you an idea of how the math works. If you have 3,858 cases on a daily basis, how quickly that can increase to 16,000. And if you want to plug in a number less than 1, or if you look at the number where Arizona was below 1, it's the inverse. You begin to see it slow and reduce, and our trends will begin to go in the right direction. And the best way to do all of this is to mask up. Remember, you're safer at home, and be responsible. The idea of physical distancing, respecting others' physical distance, is incredibly important. So the actions that we're going to take today are going to be to minimize gatherings and large congregations. Arizonans have been, by and large, terrific, fantastic, and responsible. But we have found some situations and categories where we need to take more aggressive actions, and that's what we're going to do today. Today's executive order will pause the operation of bars, gyms, movie theaters, water parks, and tubing. Effective at 8 p.m. today, with a targeted reopening date in 30 days, in order to reopen, these establishments will have to attest and adhere to public health regulations and post it for the public to see. Enforcement will be led by local public health officials and local authorities. I think we also saw the photos and videos of some of the things that were happening around our state this weekend. And the result of that has been an increase in the spread. So with this targeted approach, we know that we can pump the brakes in Arizona, we can pause, and our aspirational goal is to get these establishments reopened in 30 days with enforcement by county health officials, but we're going to be monitoring the data along the way, and we're going to do everything necessary to protect public health. We're also going to limit mass gatherings. So indoor and outdoor public events of 50 or more will be prohibited. The Department of Liquor Licenses and Control will cease issuing special event licenses, and this is applicable statewide. Cities and counties have the authority to approve larger events, but only if adequate safety precautions are implemented, including physical distancing measures. New guidance for pools, again, with the focus of breaking up large gatherings. So this prohibits groups of larger than 10 from congregating together in or near the pool. Private pools, apartments, condos, and multi-housing complexes must post signage at entrances requiring physical distancing and limiting groups larger than 10 from congregating near the pool. We also want to bring as much certainty as possible for Arizona schools. Of course, our objective is to educate our kids as best as possible in the safest environment. At this point in time, we are going to delay the first day of school till August 17th. We'll continuously reevaluate this target date. We're working closely with Superintendent Hoffman with the objective to educate our children safely and successfully, and we'll continue to communicate along the way and continue to continue programs for kids in need. Also, we have great concern and love for our folks in long-term care facilities, skilled nursing facilities, and some of our folks that are developmentally disabled and have not been able to be visited by family. We want that to happen. We will resume that as soon as it's safe. So if you want to see mom or dad or noni or papa, we've got to bend this curve the other way. We've got to slow this spread. In the interim, we are going to be sending $10,000 per facility so they can purchase iPads and screens and digital devices so we can have more interactions between loved ones from home to long-term care facilities. There will be a lot of flexibility, but the objective here is that they will have devices that work so regardless of how big the device needs to be, so that the person inside the long-term care facility can see their loved ones and communicate.